Thank you so much, everyone, for joining us tonight. We're so happy to have you. And just as Michele stated, definitely make use of the chat. If you have questions and are just curious about topics or want anyone to kind of chime in on a thought that you have about technology, please feel free. I'm going to launch right in with our guests and our topic tonight, which is going to be focused on technology and the fact that you can't get away from it. I like to call them the little glowing rectangles that everyone is tied to, and you're starting to see them crop up in mental health. And we really should be talking about this more often. So we have a fantastic panel of individuals who are going to be talking with us about using technology in the mental health sphere, what it means, what it looks like, and how we can be thoughtful about its use. So joining us, we're going to start with Dr. Sharon Lo. She is a thought leader and has been doing fantastic work in the area of pediatric digital health. And she's passionate about increasing access to mental health services for marginalized communities and really looking at evidence-based practices for our clientele. She is a licensed clinical psychologist and an assistant professor at Pacific University, where she directs a research program that's dedicated to promoting promoting emotional regulation skills and positive well-being for children. So she has several areas of expertise, one of which being pediatric anxiety, chronic pain, and parent training, and mindfulness-based interventions. So she is really well-versed in many areas, and she leverages her academic training to inform clinical and research strategies in her role as Chief Scientific Officer at Devi. Now, she's got a lot of roles and a lot of information, so definitely join us in welcoming her to our platform to talk about technology and mental health. Next, we have, and I apologize in advance if I do not get her name correct, but Dr. Zief-Balteriski. And Addie is a senior product manager and member engagement at Teladoc Health. She's a psychologist, entrepreneur, product leader, and she applies her particular expertise as a behavioral science specialist in the field of community wellness, technology, and consumer behavior, which, as you know, this is an exploding field. So her skill set is definitely something that we are grateful to have with us to talk about. She's also a researcher in the field of well-being, human computing interaction, and technology, and presents her work at universities and organizations in the Bay Area, and I'm sure in many other places. Adi is a senior product manager, again, at Teladoc Health, and the leading company, which is the leading company for telemedicine. She's in charge of member engagement and experience, which we'll definitely want her to talk a bit about. And she's previously opened up a successful private practice and a consulting business, and is engaged in product consulting for consumers and well-being products. After working several years as a consultant for startup founders in the Bay Area, she shifted her focus towards the tech world. Adi began working on products at startups focused on the well-being of individuals and communities. So we'll get to learn more about her particular skill set and products that she's been involved in, such as different apps, and her particular view set on the work that she's been doing. Thank you. And then last but not least, we are joined by Dr. Steph Peters, who's a clinical psychologist and former Stanford Circ Fellow and the founder of WellRu. She has a background in delivering pediatric and family psychological and behavioral services, as well as designing high-value care delivery models and making healthcare experiences better through the use of technology. Prior to developing WellRu's self-guided online parenting program, she was the behavioral medicine director, and my screen just jumped a little bit. I apologize for that. She was a behavioral medicine director for Carium, and I apologize for that gap. an early stage startup at the digital health company based in California. So she's going to bring to us her particular skill set and understanding how to bring a personalized science-based practice to parenting strategies and families at scale. So thank you so much, everyone, for joining us for this wonderful event today. And without further ado, we're going to jump into some questions. So first and foremost, as our founder had discussed earlier, we're a panel of all women. And so I'd love to know a little bit more about what brought you into working with technology, and also just kind of what technology means for you and its use in terms of bringing it into mental health practices. And for this question, let's start with Sharon. Let's go in order.
Yeah, sure. Thank you for such a warm introduction. I think that this is such a great opportunity to have this platform to talk about digital mental health, because it's pretty timely. I think this past year with the pandemic, we've really seen just tons of funding getting poured into digital mental health companies now too. So the amount of growth that some of these companies have experienced is like triple and quadruple fold. And so this is really an important conversation to have. So for me, I, kind of went through a traditional clinical psych grad training. And then by the time that I got to internship or residency, I was at Stanford Children's Hospital. And so was in the Bay Area. And it seems like people who are involved in this world at some point have a touch point back there. And around that time, I started hearing about startups that were designing different apps to improve mental health and wellness. And I'd go and I'd look on their websites. I'd be like, oh, there are no clinicians. Like, I was flabbergasted. I was like, they are clearly designing products that are, even though they're not calling it mental health, anxiety, they're not using the terms, but it was all behavior change. And yet, it blew my mind that these are folks that were garnering a lot of money and funding. And so at that point in time, I was like, oh, I feel like psychology is a field. And in my training at that point, like, we hadn't had any conversation about tech or how it's incorporated into mental health care. And so I just knew at that point, I was like, this field is going to go on without psychology and without therapists. And if we don't get involved in it now, there's going to be something that is really lost in that. And so from that point on, I think I wrote a blog post, and it got picked up by a really early stage startup. And they're like, you seem to know something about psychology. Do you want to talk to us? And then from there, I was hooked, because that process of being able to share information that was from the evidence base that we've known for a really long time. It wasn't material that was rocket science, honestly. And yet on the startup end, they were like, wow, this is amazing, which is the exact opposite of what you usually experience in grad school, which is like, just critiques everywhere. So I was like, oh, I really want to stay in this field. And so, yeah, from that point on, all the networking kind of links I included in the companion guide was really how I ended, and that's how I met Steph and, just generous people who continued to, kind of shove like different consulting gigs my way, and kind of tying in just our understanding of what technology is and defining what it is. It's when I think about it, it's anything that is potentially digitally mediated, which means that could even be, your note-taking systems right now, your electronic medical records and electronic health records. And now, because there are so many different apps and platforms and companies that are invested in digital health, they now encompass, there's entire landscape. So there are some pieces of technology that are, it's actual equipment, hardware. So people wearing VR headsets, augmented reality through apps, or you think of like Headspace, a meditation app. And that's more like self-care. And then you also have telehealth platforms, and where the platform is supporting the care that is happening in these virtual visits. So there's a lot of different buckets, and I'm sure we'll dive into all of those, or some pieces of those. But I'll pause and let the other panelists go.
Thank you. And how about for you, Steph? You share with us your foray into the world of technology and mental health, how you got there, and how are you defining technology?
Yeah, I think like other people I started wanting to move into technology because I was frustrated with the systems that we work in. So when I was training, I felt very frustrated with the obstacles to clients and patients being able to get good care, whether that's long wait lists or the cost. So after training in my clinical fellowship, I did a fellowship at Stanford's Clinical Excellence Research Center, which is a magical place that's dedicated to making healthcare cost less at the same time as being better. And there I learned that we don't have to be in these fixed systems. Like, we can actually change them and make them better. We can make them more patient-centered. We can make collaborative care a thing. We can make them cost less. And we can also make it more satisfying for clinicians to practice in them. So after that fellowship, I was fortunate enough to work for a startup that was doing remote patient monitoring, which is basically using wearables to collect data to connect what's happening in clinic offices with what's happening with patients in real life. And that really solidified for me, like, technology can expand the scale and reach of great care. So Wellru, which is the company I founded, was really me trying to combine all those things to see if we can use technology to help make it easier for parents to access a first step of care. And then with the technology piece, I don't think I can add, you did a great job, Sharon, and a really comprehensive job. It can be anything, any tool we're using. And yeah, I don't think I can add anything to what you said. So thank you for that.
Thank you, Steph. And then we have Adi. Can you share with us?
Hey, everyone. What a wonderful group of women. Very impressive. So I also started as a clinical psychologist. I was always interested in technology. I can't say I always had the first iPhone that came out. I was the one who's standing in line. I love technology, okay? But started as a clinical psychologist. But pretty quickly after school, and I think I shared a frustration from the system as much as you. First time I actually saw telemedicine. I was working in the ER, and there was a need for a psychiatrist, and they brought a telemedicine into the room. And I was like, this is so easy. It can reach so many people. The psychiatrist doesn't really actually have to come. And I, really started to get interested in that and finished school. Pretty quickly moved to open a private practice, pretty quickly moved to consultant to tech companies, really started in consulting to CEOs of companies for digital health and all that, and really discovered the world of product, which fell in love immediately. It's kind of a niche of that technology, psychology, and consumer behavior. And like you said, when you look at the website and no one was a psychologist, I was like, how are you building those products for consumers that need mental care or wellness or whatever, and only thinking about the product? Mm-hmm. Like, you don't build by thinking about the product. You build by thinking about the consumer. So I pretty quickly discovered that niche, when really aimed my career there, started consulting to all kind of digital health companies, and pretty quickly got into an artificial intelligence company that was trying to apply their technology to build enhanced wellness product. We built from scratch together a product that was a smart journaling app that was based on artificial intelligence and positive psychology. I was the only psychologist there with all those PhD in artificial intelligence. It was quite an experience. It was really awesome. I learned everything I could from there about product. We went to universities, we did studies. So I also did the UX research part and the product part. I kind of was a one-man show with a team of a lot of developers that were amazing, and pretty quickly knew where I'm going. So I did that. I opened a startup for 2 years as well. Saw a lot of opportunities in the mental health, wellness, all kinds of well-being sphere that, you know, people like us that are psychologists can do. After the startup, today I work at Teladoc Health, which is the virtual health solution worldwide, helps people get access to virtual care that otherwise they wouldn't, also mental and medical. I help shape the consumer experience for both medical and mental health. And I can see every day how the advantage of being a behavioral health expert come into play in this work. You know, it's amazing, the industry skill, how much power it has, right? People are sitting in, you know, super smart people, I can't say that they're amazing, talking about things and the basic of the industry skill of what the consumer needs, of how to kind of create that customer experience that people want to use is missing. And we have that built in, which I think is pretty great. So I think that the skills that we can bring into the table are something that we don't appreciate much. And technology, what is technology? Technology is, I think Steve Jobs said, it's nothing. It's the people and what they make of it, right? It's how we take that and build something. And I know it's like very innocent to say because he created a monster, but but I have a very innocent way of looking at it. I want to make an impact in scale. I sat in the therapy room and I made it, you know, it's an amazing profession. Like, I love it. You know, you make an impact and it's super rewarding. And I'm like, how can we take this and make it big? Make an impact on people that won't come to my practice, that are, you know, that don't have access to it, and kind of built on that and create a scalable experience. And that's my core and what I go with in everything I do. So this is my story.
Well, thank you so much for sharing that, because in talking about how you came to developing your skill set, you're talking about what you learned and your skills. And I'm curious, for each and every one of you, what areas do you your training with, you know, whether it's your educational training or your internships or training sites, how did they prepare you for you to be successful in the industry with working with technology? Because I can't imagine any of you were using iPads or maybe EHRs, but apps during most of your training. And for this question, let's start with Steph. Oh,
great. Sorry, my mic is, can you hear me okay? Great.
Yeah.
Yeah, so I think that's a great question. We are awesome as therapists. So I actually, when I think about startups, I think there is no better person to be leading digital innovation than a therapist. None. So I think when I think about what a startup's trying to do, and a company working in digital innovation, they are trying to get to an end goal. And then they have to figure out the map of how to get there. And then they create ways to measure that over time. And then they have to iterate and change if you are off course from meeting your outcomes. And doesn't that sound like therapy? Like, I think we are amazing at reaching goals and measuring them. We are born to be leading, not just being a part of the conversation like we've talked about. Like, we should be leading. We are well suited to be leading digital mental health innovation, of course, but also broadly digital health innovation. We have those skills. And I think another feature of psychologists is we're excellent at working in multidisciplinary settings. So we're excellent at working, knowing where our scope kind of ends and, you know, referring to a psychiatrist or another practitioner. And that skill set lends itself super well to working with engineers or product or sales. Like, we have a lot of skills that make us well suited to be a part of, not only a part of these conversations, but leading them. And I'd love to hear what other people say too.
Sure, and feel free to jump right in.
I can go next. I completely agree with you, and I see it every day in the work. Like, the sensitivity as a therapist that you have to work in a multidisciplinary teams is a huge advantage, and it moved the needle. It moves the needle. It makes things go faster. Much less friction is happening when we come into the picture. And like I said earlier, the industry skills is something that is unbeatable, right? We know the client, right? We know what they want. We are the voice of the customer, and this is how you build the product, and not the opposite. Not like someone is sitting and saying, "This is the product I want," and fall in love with it, and that's it. It's over. This is not how you build a good product that people can use. And I think school definitely prepared me for it, psychology school. And I highly, I started doing product design classes, habit formation, to learn all those kind of how to create habit within your clients. I highly recommend the FOG model bootcamp, which is pretty awesome. Kind of teach you about tiny habits and how to build a habit with your clients if you are interested in the product world, which I'm advocating here for all the psychology people to come to product. So I learn all the time. I have tons of gaps, but I also have a lot of advantage. And it's okay. If you come into the world of product from a technical perspective, it's one thing, but all the rest of the people that are coming from product, they all have different background, and they bring different value. You don't have to know everything. It doesn't work this way, right? And I have lots of gap that I learn as I go, and I'm a good self-learner. So it's not rocket science. Someone said that before, and it's true. So prepare for a lot of self-learning, but you can be successful at that. Right? You can take classes online. There's a plethora of information that we can access today, whether it's UX, product, or anything else you want to do. You can really build on the skills you have and be successful in that field. It's the resistant, and I understand it. And it's the initial fear of the imposter phenomena that I have it. Like I have a chronic imposter phenomena. I always think that someone will, in a second will see that I'm not who I say I am. That's normal. I just don't let it lead my decisions, right? It's there. Mm-hmm. I know when it comes. I know how to deal with it. But it's okay to have that as well, and to acknowledge that and to move forward and kind of make that decision. And you can do this. So that's from my side.
Yeah, I'm the same. I have imposter syndrome too. Yeah.
Chronic. I call it chronic imposter.
Yeah. So I completely second the multidisciplinary aspect. I think these tech pieces and learning tech language, the industry, those are all pieces that are learnable. But our foundational knowledge of what we have from therapy training, from psychology, that's irreplaceable. I think that takes a number of years to be able to develop something like that. So meaning theoretical knowledge of how behavior change works and how intervention works. And then the other key piece is being able to then translate that for folks who are not in your field. So I think a lot of the work that I had in just giving, community-based presentations and talks, being able to explain a psych concept in using visuals or metaphors, all of those things. And then I'd also say that, like most other industries, digital mental health, also there's a dire need for culturally responsive clinicians, because these systems are moving quick. And without that critical skill set of cultural humility and responsiveness, you're going to be designing products that are not going to be consistent with that. So that's definitely a danger. So I'd say that for those, therapists who are tuning in and have that skill set, we need you.
I think it's a great point. And I think, what you're speaking to is probably one of the disadvantages of technology, is that it's ever changing so rapidly. It's what's best about it, and it's also the challenge, right? And so in knowing that, you need to make sure you do have the right people helping to write in, whether it's code or whether it's the dialogue that you're using with the AI that is culturally sensitive. And it sounds like from everyone's responses that there are things that you had to learn along the way, but you didn't necessarily have to learn HTML, JavaScript, or Python in order to come in and be able to work with developers on building a product or even coming up with an app. And so I'm going to kind of pivot this question into two. So I'm wondering, were there any shifts that you had to make in terms of your learning so that you can be successful in that realm? And how did you go about doing that? Besides, just doing the self-learning, did you have mentors, or was it just ask questions? And how about you start us off? Go, whichever.
I can start and say that it's the fear of not saying you don't know, because you come into a place and you want to kind of be, I know it, and you don't ask questions. And I think this is where it started to get complicated. So when I came into this field, I said, I know I'm okay. I have a PhD. I'm okay. I'm not going to be considered as not smart, right? But there are things I don't know, and I have to ask. And so I got into the habit of asking things I don't know, which I think is very, very important. And I think the mindset that I needed to have is that, there are some things I can learn. And at least being a product, right? I don't have a technical background, right? So everyone is different. So to fill in the gap, I'm not saying I know how to code, but I say I talk to developers a lot. I try to understand how things are working from the back end. I read a lot about it. I'm not going to start coding. It's not going to happen. But at least understanding some stuff was something that I definitely did. And see where you can bring the value, right? And find your niche. Right, built on your strength and fill in the gaps. So that's how I see it. Right. So I had those questions like, who am I to work in tech? But it's completely normal. Ask questions. It doesn't mean that you're not smart. So that's my tip in terms of that.
Yeah, for me, I think a big mindset shift that people talk about quite a bit is the pace, and it would be me sending over some of the content that, I had to write up a program that was evidence-based for blah, blah, blah. And then the team would say, okay, great. Like all those changes are made. Here's the platform that we now, have created within 24 hours, and this is coming from my experience of, our 17-year gap that we know about, right? From the inception of a research project to getting into the community. So I was just like, oh my gosh. So it's both, of course, the power of being able to have tech-enabled solutions, and also kind of like the beast that you have to watch out for. And by way of mentors and mentorship, I've definitely benefited a lot. So, I had referenced this group. It's the I always get the acronym wrong. I think it's the Women's Entrepreneur Leadership Laboratory, WELL, and it's also a group of women. And so when I saw that, and this is when I was on internships, I was still in training, and it was so inspiring. And I was like, what are the chances that they'll email me back? And all of them did right away. And they were all so generous with their time. I think they were all, and still are, pioneers in the field. Steph is one of these women who was on that in that group. And I think they were just so excited that other people were excited about this field. And so wanted to help me out and see where the other, because there hasn't been a trajectory to this. So it's been very, who which has its own problems. But yes, I've definitely benefited from that mentorship. And now there have been, there's another group that has now formed, Therapists in Tech. And so that one's actually pretty rapidly forming. They started at the beginning of this year, or maybe December of last year. And so I'd say that if you're at all interested in stepping into this, or just wanting to connect and seek some mentorship as well, go ahead and look them up. They're great.
I think that's fantastic as a resource, and for any of our viewership watching, make sure that you do check into that if that's an area of interest. And I'm just kind of thinking about where we are now. You talked about the explosion of technology and access and making sure that we can reach the masses. Well, COVID, right? So there's been a huge need to be able to reach a number of individuals quickly and provide support, whether it's wellness, mental health services, et cetera. And I'm curious about what each of you have seen in terms of the impact of COVID and digital solutions and technology, particularly in the mental health world. What would you say have you noticed the most? Steph, would you like to start us off with this one?
Sure. Yeah. I would say, we had a mental health crisis before the pandemic. We had the demand was greater than the supply, and then the pandemic happened. And now here we are. So I think what's been interesting to see is if you'd asked me in 2017, when do you think the majority of therapists will be practicing telehealth? I honestly would have said 2050, 2060, maybe. Most of my, a lot of my colleagues use paper-based notes, and but then here we are because we had to. So there's a couple things that are very interesting for our field, and I think we'll look back at this time and for better or for worse, this will be a defining moment for our field. One is that the demand is so great. Mm-hmm. The supply, this is just anecdotal, but I think the supply may be less because of a lot of the people providing clinical services are women and a lot are parents, and we've been parenting. So being able to take on more or even as much has been difficult. So we can't depend on the supply increasing. And then I think we've got this awareness. So suddenly it's like employers suddenly, are really want to meet this demand. And there's Sharon mentioned, there's a lot of investment happening. So people are creating companies, and then healthcare itself is unlocked. So the healthcare system right now is at this really interesting time where we're open to doing things differently because we have to, that window's narrow. So it's great that it's like that. But I think, there's a lot of stuff cooking, and I think we, especially the therapists, on this call, we can all, try to guide, the environment to go where we want it to go. But it's definitely a defining moment, and we're of course seeing an increase in need because of what people have been coping with this year.
I completely agree. I think it was a speed education of the market that will remain, like you said, I think long after the COVID is gone, because people realize that they can also get care from the comfort of their home with no commute, people that would not go to care providers otherwise. And I think that's the major change. If you had to convince someone to do online care once in a while, now you kind of have to convince them to go back to in-person, although I do think the magic of in-person will still remain. So I think because of the length of this crisis, so it's also, made an impact because it allowed people to see the long-term positive effect of it, not just, a month, right? It's been a year, so a year and a half. Right, almost. So I also think it's affected the virtual care digital industry, obviously, in a very positive way. And I work in one company that it happened to, but it gives much more people opportunity to get care that otherwise, like I said, they couldn't. It will have an impact on our profession, and I think it's kind of the mindset of, we gotta move on from the resistant, because there is a resistant, and I completely understand the resistant, by the way. But we have to kind of look forward and say, this is here to stay in some ways, and maybe it will be hybrid, and maybe it will, but it's not going to go back to what it used to be. And I think that's the tough realization of our field. It's also tough because it's, we believe in the magic of in-person care. But I think the magic is not in the in-person care. I think the magic is in the care. So I would kind of change that mindset and work through the resistance. We know how to work through resistance. We're therapists. Come on. So now we have, right. So I think this is where I am seeing it from both ends, as being a provider once and now being where I am today.
Wow. Any thoughts that you'd like to add, Sharon?
Yeah, I mean, one of the things that was thinking, like, certainly like with the venture funding that has gone to these programs, it was already increasing. But then each year, since the increases have been happening, it's been like record breaking. And so 2020 was no different. One of the trends I've seen just in the industry is certainly this past year, there's been much more like cropping up of child and family services and parenting services. And the other thing that I want to kind of like bring into our like awareness too is this idea of global digital mental health. So with tech, it's opened that up, and it's just making me think about how much we'll really need to be even more mindful of global context, right? And the things that are going on in other countries, right? India in particular right now, and that they also have digital platforms where their therapists are supporting people in other countries. And so what happens when your nation is going through a global crisis? And, so that I think is going to be, just like a really important thing to bring in.
I think it's a fantastic point that you're thinking about, because we're seeing it actually with other countries where there isn't a supply. So they're seeking clinical support from other clinicians who are outside the country. And there are many countries that don't have clear rules around, like they don't have an APA or they don't have a governing body. And so they're scrambling to kind of create that in the moment. So technology is kind of forcing us to move at a much more rapid pace to get on pace with what these advances are. And I think it's absolutely wonderful that we're kind of at this tipping point where we have the option of being able to bring mental health services to such a broad group. And, it makes us think, where is this going in the future? What are your thoughts in terms of seeing technology in mental health, and how do you think it will support traditional approaches of mental health, or will it? And Sharon, you want to start us off on this one?
Sure. I'll start off. This was actually something, just bringing up that resistance piece. I love that. Most of the digital mental health companies have been speaking about their products and the platforms that they use. Certainly not as a replacement for therapists. Like, I don't think I've come across one tool or app or anything like that where they're promoting that. So my thought is that, yes, therapists are here to stay, but it's more about how will we be integrated, or how will we be using these things? I think one of the most powerful tools I've been able to use, like in session, is tracking. Some of the digital tracking, like from week to week, is much easier. And so then when families are bringing this in, way quicker to be able to talk about some of these things. So that's definitely one format. But as one other kind of like issue that I see people grappling with as more and more therapists are serving as clinicians on digital platforms in contract-based roles, is that you lose the community of a consultation group in a private practice setting when you're walking around in person and being able to be like, oh, hey, what do you think about this? And so you're losing that. And so I see these companies that have really large provider and national provider bases that are struggling to get that type of culture set in. So then their therapists are feeling pretty isolated. So I think that is something that therapists will need to think about as they're kind of putting together how they potentially want to be involved with these different companies.
Thank you for that. That's really helpful, because that's one of the complaints of private practice, is it's isolating and you have to find your community. And that's one thing we've heard lots within the Third Thursday, platform. We have to find a community. And even if you are curious about finding a community, definitely check the networking option here on this platform at the end of this discussion. But I'm curious from Steph or Adi, if you guys have thoughts on how you see technology either supporting therapy in its traditional approaches, or helping therapists move forward, or not. What are your thoughts? Would you like to start us off, Adi?
I think it's a very good question. I think there are verticals that would most likely benefit from going to in person. And like, nothing is coming to replace. I think being a therapist is the thing to do, because it's not going to end. Like the fact that artificial intelligence will replace us is long, long gone, right? Like it's the last thing that will be replaced, right? So there is no worry about that. We just have to change our mindset on how we're doing that, whether it's like, the cadence of doing that in person versus virtual, doing a hybrid model, combining it, or, it does open a lot of professional opportunities as well. You can work in multiple companies, you can do all kinds of stuff. So it kind of changed the way the profession behaved until today, but there was a lot of good things that are coming out of it, right? So it's worth looking at it, from a different perspective, and move on to how are we going to leverage all this change to kind of succeed in the world that we're going to live in from now on. It does have an impact on, I don't think that the connection that you make with, I can touch that right now, but the connection that you make with the client can't be fully translated to online. And I think that depends on whether you start online or kind of clients move online. And maybe there can be a solution of, first few meeting, you're doing that. And then there can be all kinds of solutions that can happen. But that's my intake on it. I think that there need to be some change, but it's a positive one.
Mm-hmm. Thank you. And how about for you, Steph?
Yeah, I totally agree with what's been said. We are not going to be replaced by technology. We're not. I think technology can be used to improve the things that we are not great at as a field. So we can be used to improve access and care. Technology can be designed to reduce disparities. We can reduce overall cost. We can create new models that combine, that in-person care and connection, and then offloading some things to technology. I heard the phrase bricks and clicks last week to describe that combination of things that are in person and then on tech. It's catchy. But yeah, I think technology, we talked about at the very beginning, like what it is. Like, I think for the people on this call, like it doesn't need to be AI, blah, 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 that's coming for you, or like spies in our computers that record, our conversations. Like it can be used to make your work as a clinician more fulfilling and help you create better connections with your clients in whatever way is comfortable for you. So if you're spending a lot of time writing notes, there's probably a user-friendly EHR that you can use, or a way of streamlining that. If you're like Monday, like spending a lot of time listening to calls, voicemail calls, there are HIPAA secure phone systems that are on your computer that transcribe so you can look through more quickly and prioritize. If you feel comfortable setting up boundaries around scheduling, figuring out what that looks like for you, you can shift the scheduling stuff to an online portal on your website. And then if you're in an academic setting or a large system, these startups are hungry to pilot with groups, and they want to be validated and study. So you'll have opportunities to work with that. But I think the short answer is we're not being replaced, and that we can use technology for good. And we have to be intentional about that. Otherwise, it's not going to be used for good. And that's where I think the people on this call come in, can advocate for it being used in the right way.
Well, I think you're really helping to point out that there is always going to be the need for a clinical mind, and being able to help understand, just the necessities of the human experience, and that can't be replaced with AI. And also just you're pointing to areas that are still underdeveloped, and we're looking at how to continuously develop those areas, which brings me to my next question about what do you all feel are some of the pitfalls of the digital mental health industry? What are some of the areas that we need to definitely be keeping our eyes on? And Ali, can you start us off with that?
Sure. So I think I talked a little bit about before the challenge of creating a safe space with clients and connection is something that it definitely needs to be learned. It's a different kind of skill, right? It's a different kind of skill to do it online when you see yourself all the time. I highly recommend the hiding self-view. It's just, we lose some of the nonverbal cues. So it's a completely, you need to learn it. So take trainings on it and kind of learn more about it. It's a different skill we need to have in the world we live in today, regardless if you will continue this work online or not. So I think that's a challenging aspect. Obviously technical challenges that happen, and I'm talking about really like, the nitty gritty of it, but it happens and it's awkward, and it's, someone can tell you his whole life and suddenly there's a technical glitch, and, so those are the stuff we have to kind of work through. I also, of course, HIPAA and privacy and all that, kind of figure out what are the software that are, there's so much out there if you Google it. So I don't think there's a place where you can really know, which I wish there would be. What can you use? What is safe? So those are the challenges that I think the profession is needs to kind of work through, and that's from my side.
Sure.
Yeah. So one of the I guess I would call it a potential pitfall. Like it could become a pitfall, but an area that I believe is an area that we need to be watching is in kind of related to the HIPAA stuff, but risk concern. I think that is one, like for certain apps, like and ones that we'd call like, lighter touch, right? It's kind of like it's psycho ed, so there's not really an intervention, but some of them are also programs like delivering that kind of content, or it's a chatbot, right? And for the most part, the way that I've seen it is that companies are kind of like, whoa, like we don't want to touch that. They're just kind of like skirt around it. And, they just make sure that there's a disclaimer, and they make sure that their legal boxes are checked. That's like their main concern. But as clinicians, like it's our duty to really be diligent about this. And so then once you start entering a clinical voice, like onto your team, I think it's a really critical issue that needs to be flushed out. So, there've been a few papers kind of like coming out on like how is the field kind of reaching consensus on this. There's still consensus being garnered around just like risk assessment. So then when you move it over into digital risk assessment, like I really think that's going to be, I feel like the for the funders out there, it's like whatever company can figure that out, it's huge. It's a big area. So I think that's one to watch. And then the other pitfall I feel like that is a potential for the digital mental health industry is this idea of moving too quickly. So I kind of referenced this before, but it's one that I think about a lot because yes, it's great that tech moves quickly, but if we're just going to move fast and then create the same inequities that our healthcare system already has, you're just going to make those gaps wider, faster, right? And so that's where you really start thinking about like, who's at the leadership and at the helm of these companies, designing these apps, designing these products. Do they really have, the community that needs it the most in mind? And how do they think about this? Because otherwise we are going to see the same problems.
That's such a great point. I don't think many people give that particular point enough credence. And like, if you're just looking at speed, and we're also talking about the human condition. The human condition doesn't change at the drop of a hat. It takes a significant amount of time. Yes, it can be quicker. And as a past behaviorist, I totally understand like stimulus and response, reinforcement, etc. However, it's still not going to be within the breakneck pace of technology. And I love that you are all speaking to the importance of working with, these programs to help them understand how the human condition unfolds, how change, takes place. And yes, thinking of risk, because I know a lot of clinicians are afraid to touch technology because of liability and risk. So I'm so glad that you're touching that as the topic. I'm just going to move. Well, I'm sorry, Steph, do you have thoughts that you want to add? And then will wrap us up on our last questions.
Nothing too much to add. I agree strongly with everything that was said. And someone had written in chat about explaining risk of confidentiality to their clients. And I think we haven't figured out, someone else mentioned this too, like haven't figured out a way. I wish there was like a catalog, you know, we could say like, good to go, like stay away from this one. Right now, what we're just trying to figure out what to do is informed consent, I think goes a long way. So we're choosing choosing platforms that are HIPAA secure, and then also having conversations with our clients about them. Like if people want to be texting, or you know, if there's barriers that we're overcoming because we're using technology and they're okay with a certain amount of risk, I think being able to have those conversations is important. But I think you know, that's another reason that we need therapists in the room, is to communicate. Like we can then help people design for like what types of information they're collecting, and when do we want to be recording the sessions, you know, and when do we not want to be, that kind of stuff.
I think also just to add to that confidentiality piece, and just understanding, we're talking about large groups of people, and anyone using the platforms, they're going to find it as their pocket therapist. And I know many have dubbed it their pocket therapist. And so even though, you know, the clinicians working on the platform or the individuals behind the scenes see this as one thing, we might have a whole host of consumers who understand it completely different. So it definitely begs, you know, the service of having these conversations over and over and over, and saying like, this is not the traditional therapy, and clarifying the roles so that we don't have mistakes in the future and assumptions that are made on, you know, incomplete information. So I really want to just like appreciate everyone for sharing your thoughts, your perspectives, your experiences with our group today, because it's been such a wonderful opportunity to hear how clinicians are making such an amazing impact in the field of technology, and how it's ever growing and quickly growing, and what areas need to be filled. So I'd love for you each to share some thoughts, you know, just for our viewership, our providers, just so that they know how to prepare for the growth ahead and be prepared for, you know, bringing technology into their practices. What thoughts might you have for them? And Sharon, do you want to start us off?
Yeah, sure. So I guess like I feel like this has been a theme that's come up throughout the panel. But I guess I just want to start with saying that you know, if anybody's the least bit curious, to know that their input is invaluable to this industry. Like I feel like the clinical voice is so needed, and these companies are learning that it's so needed, right? And so even if you feel like, you know, this is just totally like, it's so new and like I don't even use any tech right now, I hate tech, you know, all of that, that's okay. I think as long as you're bringing your clinical expertise, honestly, that's really all that's needed.
I can go next, and I want to piggyback on that, because you know, a lot of companies want consultant or advisors that are mental health providers. Since I'm an advisor for a company that has like a anonymous chat for mental health, and they need that input. That it's you know, it's really something that you can do. It's not just out in the air. It's really something that is needed. And I say in 10 years, there will not be a company that will not have a psychologist there building a product. I am positive about this. And I said that many years ago, and it's starting to happen. And I see it because I'm in the industry, and I see how UX researchers are psychologists, people coming from academia. Facebook is hiring psychologists. So it's out there, it's happening. People are starting to understand we are needed. Get out of the couch, right? I used to say as a mental health provider that the change will come. And now I'm saying it's here. So we need to adapt. It is possible, and it's not a black and white. And you know, what we want is to make an impact, to change people's life. And there are many ways to do that, many ways and tools to do that. And it's an opportunity to mold, the profession to something more innovative and to something that will reach a lot of people while still keeping the magic. So, this is where I'm coming from. And I really enjoyed tonight, by the way. You were all awesome.
Yeah, I want to do this every day, like same time, same place tomorrow.
Yep,
everybody.
sure.
It's really exciting to talk about the impact that our field can have and the importance, I think, of us advocating for our field and ourselves. So I would, encourage people to look for small things if they're in a smaller practice or a group practice, like what is a pain point for your practice, and then how can technology support you to make your job easier, make it, patients happier, that kind of stuff. And then there was another comment in chat about worries about companies being formed with no psychologists at the wheel. And I totally understand that and share that anxiety. I get emailed from friends like, have you heard of this startup? They're doing this and this and this often. And then I'm like, they don't have a psychologist. Like, I feel that fear and that anxiety. And then the thought I have to myself is there's a reason why people feel like they need to innovate. And there's a reason why they feel like needs aren't being met. I don't wake up in the morning and think I'm going to make a ride sharing app. Like we need that so bad. Uber and Lyft, like they're good. They've got it.
I did it once. It's hard.
We'll have to talk about that later. But there's a reason, like we see these companies come up, and that's giving us a signal that people are saying our needs aren't being met. The community's needs aren't being met. Like we need something different. And I would encourage people to be bold and like reach out to these companies that you have anxiety about. And I know we're all like, especially people working on the front lines right now, like very, very burdened and taxed, but you can reach out and say, hey, I'm happen to be a psychologist and interested in what you do. And interesting, I have a decade of experience in what you're building. Like, let's have a conversation. And that's like actually how I had started doing consulting in tech too, was just reaching out to people and saying like, do you need somebody? And they can't always compensate if they're early stage, but they usually are grateful for the help, and it helps alleviate anxiety individually.
That's wonderful, to be able to have that tidbit of knowledge that you can just reach out. And I think that's sometimes, a big barrier to even starting the conversation, because it's like, oh, these, as Eddie said, like there's these brilliant minds who are developers and yada, yada, yada. And so they feel intimidated. And then once you get there, of course, imposter syndrome rears its ugly head. But the important thing is to continue. And like our profession, we have practices, right? Because you're always learning. So I really appreciate the fact that you don't know everything. You never will. You're going to continue learning. You're going to continue growing, and you're helping to really support a large community in their mental health and well-being. So thank you so much, everyone, for joining us and talking about this rich topic. And for everyone who's watching, we hope that you got a chance to ask your questions in the chat, and that we've been able to answer some of your questions and really alleviate some of your concerns. And with that, we will call it a night, and until our next event. Thank you so much, everyone, for joining us. It's been a pleasure speaking with all of you. And with that, I just want to say thank you again for joining us. And if you haven't already, please take a look at the TogetherWell platform. Stick around for a little bit if you're interested in networking. Definitely take a look at our networking session on networking section on the TogetherWell platform, or the Hopin platform, and stick around for the PADS yoga and meditation. And if you have any questions or are interested in learning more about TogetherWell, please go on over to TogetherWell.com, and you'll be able to see a list of the events, learn more about hosting your own workshops, and be able to connect with other like-minded individuals who are learning more and more every day. This is our third Thursday for the month of May. Please join us next month as we will be talking about supporting essential workers, those working on the front lines, and helping support them through such a challenging time as they've been working so hard. And we'd love to have you view and watch and learn so that you have the best skills to support them. Thank you so much for your time. It was lovely chatting with you all as always, and hope to see you next time. Take care. Bye-bye.